What to know about survival of breast cancer. Welcome to our video on what to know about survival of breast cancer. Breast cancer is a major health concern, but thanks to advances in early detection and treatment, survival rates have significantly improved. In this video, we'll cover essential information about breast cancer survival, including factors that influence survival rates, stages of breast cancer, treatment options, lifestyle changes, and supportive care. Understanding these aspects can empower patients and their loved ones to navigate this challenging journey with hope and knowledge. Let's get started. 1. Understanding breast cancer survival rates. Breast cancer survival rates refer to the percentage of people who live for a specific period after being diagnosed with the disease. These rates vary based on several factors, including the stage at diagnosis, tumor characteristics, and treatment efficacy. Generally, survival rates are categorized into 5-year survival rate, the percentage of patients who live at least 5 years after diagnosis. 10-year survival rate, the percentage of patients who live at least 10 years after diagnosis. It's important to note that survival rates are statistical averages and do not predict individual outcomes. 2. Factors influencing breast cancer survival. Several factors can influence breast cancer survival rates. Stage at diagnosis. Early stage breast cancer, stage 0 or I, has higher survival rates compared to advanced stages, stage 3 or 4. Tumor grade. Lower grade tumors tend to grow more slowly and have a better prognosis. Hormone receptor status. Breast cancers that are hormone receptor positive, ER positive, PR positive, generally respond better to hormone therapy. HER2 status. HER2 positive cancers may be more aggressive, but can be treated effectively with targeted therapies. Patient age and health. Younger, healthier patients often have better outcomes. Access to treatment. Timely and comprehensive treatment improves survival chances. 3. Stages of breast cancer. Breast cancer stages range from 0 to 4, with higher stages indicating more advanced disease. Stage 0, non-invasive, also known as ductal carcinoma in situ (SICE). Stage I, small, localized tumors with no lymph node involvement. Stage 2, larger tumors or small tumors with limited lymph node involvement. Stage 3, more extensive lymph node involvement and possibly spread to nearby tissues. Stage 4, metastatic cancer that has spread to distant organs. 4. Treatment options for breast cancer. Breast cancer treatment depends on the stage and characteristics of the tumor. Common treatment options include surgery, removal of the tumor, lumpectomy, or the entire breast, mastectomy. Radiation therapy, targeted radiation to destroy cancer cells. Chemotherapy, systemic treatment with drugs to kill cancer cells. Hormone therapy, for hormone receptor positive cancers, medications that block hormones. Targeted therapy, drugs that specifically target HER2 positive cancers, or other molecular characteristics. Immunotherapy, boosting the body's immune system to fight cancer. 5. The importance of early detection. Early detection of breast cancer significantly improves survival rates. Key methods for early detection include mammograms. Regular screening mammograms can detect breast cancer before symptoms appear. Breast self-exams. Regular self-exams help individuals become familiar with their breasts and notice any changes. Clinical breast exams, performed by healthcare providers during routine checkups. 6. Lifestyle changes to improve survival. Adopting a healthy lifestyle can support treatment and improve overall survival. Healthy diet. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Regular exercise. Physical activity helps maintain a healthy weight and boosts overall health. Avoiding alcohol and smoking. Limiting alcohol and avoiding smoking reduces the risk of recurrence. Stress management. Techniques like meditation, yoga, and counseling can help manage stress and improve well-being. 7. Supportive care and mental health. Dealing with breast cancer can be emotionally challenging. Supportive care and mental health resources are crucial. Support groups. Connecting with others who have similar experiences can provide emotional support and practical advice. Counseling. Professional counseling can help patients and families cope with the emotional impact of cancer. Palliative care focuses on improving quality of life and managing symptoms, regardless of the stage of cancer. 8. Advances in breast cancer research. Ongoing research continues to improve breast cancer survival rates. Personalized medicine, tailoring treatments based on individual genetic profiles. New therapies, development of new drugs and treatment protocols. Clinical trials. Participation in clinical trials can provide access to cutting-edge treatments. 9. Long-term survivorship. Many breast cancer survivors lead healthy, fulfilling lives after treatment. Long-term survivorship care includes regular follow-ups, ongoing checkups to monitor for recurrence and manage any long-term side effects. Health maintenance, continuing healthy lifestyle habits and staying informed about new research and treatments. Conclusion. Breast cancer survival rates have improved significantly due to advances in detection, treatment, and supportive care. Early diagnosis, effective treatment, and healthy lifestyle choices play crucial roles in improving outcomes. Remember, survival rates are just statistics, and each individual's journey is unique. Thank you for watching. If you found this video helpful, please like, comment, and subscribe for more health information and tips. If you or a loved one is facing breast cancer, consult with your healthcare provider for personalized guidance and support. Stay informed and take care.